Anyway, as far as what makes me feel safe, even after they lift the restrictions, I anticipate while I'm doing the vasectomy, patients will be wearing a mask and I'm going to be wearing a mask. That's what I anticipate. Oh, all of our patients are being screened by questionnaire and they're all having their temperature taken. I understand that there's an asymptomatic phase, but again, we're doing what we can.
I want to sort of switch gears because Eric and I were having a nice discussion the other night regarding DNA fragmentation. So I want to poll the people on the call. We'll start with Jim and work around. So Jim, you're on my lower left portion of my screen. So that's why you're going first. So anyway. Person with normal semen analysis, let's say 25 million sperm, wife recurrent pregnancy loss, and multiple failed IVF attempts. One, what's your opinion on the role of DNA fragmentation, and if it's positive, do you go in that patient to testicular sperm extraction? And then we'll go around the room.
Is this Dupree or Hoteling?
Dupree. I think Jim Hoteling is I can't see him anymore.
Okay, he might be with his 6-year-old. So for the situation you described, I'd get a karyotype and I'd get a DNA fragmentation. And specifically about the DNA fragmentation, it's to identify whether there's some sort of unmeasured element of male factor quality that isn't showing up on just a standard gross semen analysis. If it's normal, then I just advise them to continue using ejaculated sperm for their future IVF cycles. If it's abnormal, I've lately been offering them kind of two paths. The more invasive path would be to offer them a testicular biopsy for a future IVF cycle. Alternatively, a course of, I know many on this call have participated in some of these trials, a course of supplements combined with frequent ejaculation, and then repeating the DNA fragmentation to see if that improves it. And I've had some patients where there have been meaningful improvements from those steps alone, and then they've continued the supplements and the frequent ejaculations for their future IVF cycles. Alternatively, we do testicular aspirations for patients for whom that's their preferred route too.
Jim, what level of DNA fragmentation would you pull the trigger to do a testis aspiration after in this scenario?
Yeah, so we typically send most of ours to the SCSA and the Dakotas, north or south. I never remember which one it is.
South,
thanks. And like a level of around like 35, 40, somewhere in that range.
Okay, so not low 30s.
No, I mean, high 20s, low 30s. I mean, to me, I personally find that the data on this is admittedly imperfect, and that for someone in the high 20s, low 30s, I'm not sure that the benefits outweigh the risks.
This is someone who's failed multiple IVF procedures in the past using ejaculated sperm. So it's doing the same thing over and over and over again, expecting a better result.
Yeah, I mean, we've started trialing some of these sperm sorting devices, the Zymotes and things like that, and it's really new. We don't have frankly a ton of experience with it, but I mean, Jason, your point's well taken. I mean, I think it's often attributed to Einstein. I don't know if he actually said it or not, but like the definition of insanity is doing the same thing over and over and expecting different results. And your point's very well taken, Jason. And so we have had couples in whom actually maybe even the DNA fragmentation is in the mid-20s, where we've been frankly unwilling to move forward with it yet another IVF cycle if everything's staying the same. And so we are, again, trialing some of these sperm sorting microfluidic type devices in those situations.
Why do we think that that's a sperm issue at that point?
Yeah, no, Jay. I mean, listen, that's the test that I always tell my patients I wish I had, right? Something after an IVF cycle to say like, hey, this was an egg problem or this was a sperm problem. I mean,
just like there's subtle sperm issues, there's subtle egg issues. So we'll have that exact scenario in a woman who's relatively young that's had normal ovarian reserve testing, and they'll say, oh, it's got to be the sperm. And the DNA fragmentation testing is very wishy-washy. Okay, so it's not somebody who's got 12%, but they're not 40%. It's like mid to high 20s, maybe even low 30s. Yeah, I think low 30s in that situation, maybe I would consider offering a testis aspiration if that's what they want. But I would be very clear that the data is, as you said, very, very soft. But
there
it could
data?
easily be an egg.
Is there data on people who are not severe oligospermic, patients who are not severe oligospermic, that we're doing testis aspirations for high DNA fragmentation?
Yeah. So there's data, and actually I think there was going to be at least 1 or 2 abstracts at the AUA about the use of testicular sperm in the event of multiple failed IVF cycles and high DNA fragmentation. I think that's one of the few times, at least in my mind, to go into the testis. I certainly wouldn't do it without a previous failed IVF, even if you knew that their DNA fragmentation was high.
Yeah,
I had one more
that was your
wrinkle to this
question.
case. The same patient has a big varicocele.
Mm-hmm.
Would you guys fix his varicocele for his DNA fragmentation? And if your answer is yes, when the patient there says, well, what's the chance? What % chance is it that you're going to fix my fragmentation? What would you tell them?
I'm going to let the professors take this answer.
Jay, I'm waiting for you here,
No one wants to
This is your bag, Jay.
No one knows the answer.
I was giving other people a chance to answer. So again, it's all about counseling, right? And I would tell them that the data would suggest that fixing a big varicocele would improve DNA fragmentation, but if it does, how much? And if it does improve, will that really make a difference? I've definitely done that. And actually what I would do at the time of their varix ligation is I would get testicular sperm. Because you're there, that's easy. So I had that exact scenario. The guy had 45% DNA fragmentation. They actually hadn't done IVF yet. Big varicocele, fixed it. They wanted to use the testicular sperm right away. They didn't want to wait to see if anything changed. Got pregnant. Finally, after about 9 months, I got him to come back in just to see if his DNA fragmentation was any better. It went from 45 to 41%. So
saved a life.
Yeah, right. I just don't think the data's there yet. That doesn't mean I wouldn't do it. Again, it all comes back to kind of sitting down with your couple and making sure that they understand the pros and cons.
I think you're right. It's all about the counseling, and part of what we do is, we kind of build the case for doing the varicocele repair. So one of them would be, do we check hormone levels? Do we check the testosterone? We got a high DNA frag, you got low testosterone, you got testicular atrophy. Maybe the guy's got a little bit of pain. For a case that's quick, it's easy, very limited side effects. Why not do it? Then the hard part's convincing the reproductive endocrinologist, hey, maybe you wait 3 months and then check again. I think it's worthwhile.
Yeah. Is there data on that, guys, on how often, or is there data on varicoceles fixing DNA fragmentation?
I think that data is out there.
There is. It's not super great. It was mostly from, the only paper I've seen is from Estevez down in Brazil, and I know that, but he's published just about everything on this topic. So because whenever I'm faced with one of these situations, I always find myself going back and reading that meta-analysis from like 3 or 4 years ago that he published in Fertility and Sterility. I know that for myself, I have done a varicocele repair on someone for elevated DNA fragmentation, but it was an easier decision because this was a couple that had not done IVF yet and didn't really have the financial resources to really run into it. And so I was like, guys, this is a procedure that's covered by insurance, very low morbidity. And, I can't guarantee this, but, I think this is going to be our best shot, at this juncture point in time. And, we'll see where you land. And I guess I'll find out where he lands as soon as this pandemic is over, and I can get his updated labs, and we'll see.
Right.
Yeah.
Yeah. I mean, my take on fixing varicocele is, if they're clinically significant, and the couple has otherwise been unsuccessful in their attempts for a reasonable time period, and other factors such as wife is not of advanced maternal age, my bar to fix a varicocele is relatively low. I don't fix subclinical varicoceles and so on. I also don't fix a varicocele for the prevention of hypogonadism in 10 years, which is I think that's a trend that might be starting. I'm not sure how people feel about that. But in this case, DNA fragmentation, relatively little evidence that it helps, but probably doesn't hurt. I can probably make a case to fix a varicocele.
Can I ask about when people are initiating the DNA fragmentation test in the first place? So, Rich, you laid out a case of recurrent pregnancy loss and multiple failed IVF cycles. Jay, you mentioned a couple that had not yet gone through IVF. Do they have recurrent pregnancy loss, or I guess I'd be curious when people initiate that test in the first place.
I mean, I don't get it routinely. I will get it in somebody who has a varicocele and they're trying to decide whether or not to do IUI. And they're, so they're not thrilled about fixing the varicocele, or maybe his parameters they're okay, but they're not great. And they could certainly do IUI. I'll get it for that. Certainly the recurrent pregnancy loss. Actually, before I go further, at least in my lower left hand, I don't know if you all can see Juggin Cancel. He's my current fellow. Juggin, maybe you want to unmute. And are there any other times we're getting DNA fragmentation that you can think of?
Not for us. I've seen actually the REIs be sending us referrals. They've already gotten DNA fragmentation. We saw a couple of those, but I think besides those indications, I don't think there's any other indications that we're getting DNA fragmentation yet.
Is anyone getting it routinely as part of their initial workup?
No.
I use it a lot to try and convince people to fix the varicocele. If I got some guy who's got a huge varicocele, low counts, poor T levels, and the guy's just like, nah, I don't want to fix this varicocele, do the DNA frag. It's just another check mark in that box that says maybe you should fix it.
Also for lifestyle changes. I had a gentleman who came in. It was like he was very professional, like dressed to the nines. And I always go through my social history questions, and sometimes I'm not paying very close attention. I'm like, you smoke, you drink, and the guy was killing a 6-pack a night and a couple of bowls of pot before he went to bed every night. And then I check his DNA fragmentation; it's in the 60s. I was like, holy crap, dude, you got to make some changes. And so whenever you show them that in front of them, and I got it because I was curious what it would show, because his parameters were not bad.
Yeah, I would have done the same thing.
Yeah, his numbers weren't terrible. If you looked at his semen analysis, just walking in the door, you'd be like, I don't necessarily know why you're not getting pregnant. I wouldn't give you an A+, but you're certainly making the grade, and his fragmentation's through the roof.
Well, it's an interesting point you raised, Dr. Tatum, is that despite all the advanced testing we have, there's really not much better than taking a really good history and doing a good physical exam. You really detect so much on the history is relevant and pertinent. I mean, Dr. Seaman, what do you think about that?
Yeah, I completely agree and have had those situations. And I recently had somebody who actually finally came back after cutting back on the weed, and it was better. Whether that was what did it or not, it was certainly good reinforcement for him. So I think, we do have to remember that, and I think, I don't remember who pointed this out before, but we are the men's health doctors. And so men's health includes, moderate alcohol and lifestyle changes, not just, here's what we can do for your fertility.
Right. When you're talking about the lifestyle changes, they had for about a heartbeat that epigenetics test, and my very limited use of that, I found that coordinated with lifestyle. People were obese, heavy smokers, heavy alcohol users. Their epigenetics test was bad. Of course, the company's bankrupt now. But I saw that as its utility when it was around.
So let's change to our last subject, because I feel like we could probably go all night with this. But we have a fellow and a resident